Good morning, friends. Good afternoon and good evening. I'm Paul Majarowitz, the Acting Deputy Director in the Office of Africa in the Bureau for Humanitarian Assistance. I wanted to thank you for joining us today and your interest in the Mozambique Resilience and Food Security Activity, the RFSA. We're at BHA. We're very excited to release this draft RFA. And we welcome your questions and comments today. And I know there's also a period to submit written comments as well, but we're really looking forward to the dialogue we have today. I want to take a special note to thank the core and expanded teams that included our BHA staff in Washington and the field, representatives from USAID Mozambique mission as well, but also USAID's new Center for Conflict and Violence Prevention, as well as the Center for Resilience in the Bureau for Resilience and Food Security, and USAID's Africa Bureau. As you can see, sort of the representation of all of those different entities, it's a clear sign of the complexity of the food security situation in Mozambique and the overall situation in Mozambique. As many of you know, over the last 6 years, USAID, between its legacy offices, OFDA and Food for Peace, provided nearly $250 million in emergency support in Mozambique to respond to droughts, to multiple cyclones, flooding, as well as displacements due to conflict. As you can see here on the slide, in the first week of June of 2020, USAID's Office of Food for Peace and Office of U.S. Foreign Disaster Assistance came together to form the Bureau for Humanitarian Assistance, which is seeking to elevate U.S. humanitarian assistance both within USAID, within the U.S. government, but also within the humanitarian system. As many of you know, BHA delivers humanitarian assistance to save lives and alleviate the suffering of people affected by the disasters. But also, just as importantly, in our activities, we seek to build resilience and to leverage development resources and programs from other parts of USAID as well as other actors on the ground, and trying to support USAID's objectives in its CDCS, as well as the country, and in Mozambique's case, its journey to self-reliance. We want to encourage applicants to see this forum as an opportunity to connect with and exchange, not just with the USAID staff, but also with each other. As I talked about earlier, the complex nature of these of the food security and humanitarian situation in Mozambique requires a collective response. Any one agency by itself probably can't address all of the factors, but working in collaboration with other actors and with technical specialists across the multiple sectors in food security, we're hoping to lead to better outcomes. BHA is looking forward to the RFA and the planned investments that will come out of it to address the challenges that we see in Mozambique. And we look forward to this ongoing dialogue as part of today, and then after awards are made, to continue sort of a collaborative learning and adapting throughout the entire program cycle. So thank you all for your interest, and we're really looking forward to the engagement today. Thank you.
Thank you, Paul. Now I will hand it over to Etienne for the overview of the RFA.
Great. Thank you, Fadumo. Thank you, Paul. Thank you, Paul. I'm Etienne Yonli, acting team lead for the Quality Assurance team in the Acquisition and Assistance Division, which is in the Office of Humanitarian Business and Management Operation in BHA. Let's do a brief overview of a draft RFA. I will start, but there will be more information in the coming slide. So the period for closing for the comments is April 5th. So please do keep sending your comments. We do appreciate it. It helps us improve the RFA. I know you will be asking questions today as well. We'll capture these too in our internal comment tracker. We are also recording, but if you feel you can be more articulate in writing, you are encouraged to send us an email as well after the meeting. There may be times during the meeting when we may also ask you to send us your comments in writing so we can efficiently address them. Since we are on the comments, so I'm going to skip to the next bullet and go over the email for comments. So the email address was in the transmission email to FSCG. It's also on grants.gov. For the people on audio only, it is fy22.rifsa.mozambique@usaid.gov. I know you also wondering, when will the final RFA be released? The answer is TBD. This is really dependent on availability of funds and at the discretion of the agreement officer. I know you're also wondering when will be the anticipated start date of the award. The response is on or about January 15, 2022. We've also budgeted time for questions in this meeting. We'll do our best to respond to your questions. We can't tell you everything because this is a procurement meeting, but we'll do our best. Information typically that generally that any reasonable person can guess. That's usually we can provide that. But for other information, when it's brand new, the best place would be grants.gov so everyone is aware. So we're not creating competitive advantage for some applicants since this is open. So in terms of the way we go about addressing your comments, we typically don't do a separate response document, although it is possible. What we usually do is address your comments through a revised RFA, which would be the final, what we call the final RFA. So that final RFA would basically address your comments and questions. So please do send us the comment and question because we take it seriously. Please also don't respond to the draft. This is a draft RFA. It's not the final. So we are not asking for applications. We don't expect them. And anything that is said here could be, it may not be what we put in the final RFA. So what we want you is to be checking on grants.gov. We also do the requirements of the Title II Act, send the RFAs in the to the FSCG community through the FSCG email. So do monitor these. That being said, I will pass the floor back to Fadumo. Thank you.
Thank you, Etienne. In continuation on the overview of the RFA, under the RFA, BHA intends to award one cooperative agreement This, of course, will be subject to the availability of funds. The RFSA will be funded with Title II resources for a performance period of 5 years. Applicants must request Title II funding. Other types of funding, such as community development funds, known as short as CDF, or monetization, are not authorized at this time. We anticipate to have funding of up to $75 million. Of this amount, up to 50% may be used to budget Section 202E. I would like to take a moment to discuss the eligible uses of Title II associated costs, including Section 202E and internal transport, storage, and handling, also known as ITSH. Section 202E requires Usaid to make funding available to eligible organizations to assist in the establishment and enhancement of Title II funded programs. Eligible uses for Section 202E funding include interventions that fall into 2 general categories, Section 202E and Enhanced Section 202E. The types of costs that fall under Section 202E include direct administrative costs such as staff salaries and fringe benefits, costs associated with U.S. government commodities when ITSH is not available, and RFSA interventions not associated with market-based modalities. Under Enhanced Section 202E, the types of costs include market-based modalities and the direct administrative costs associated with market-based modalities. So market-based modalities may include local and/or regional procurement of food, commodities, cash transfers, or food vouchers. Additionally, as a Title II award, the RFSA will also be eligible for ITSH funding to cover in-country costs directly associated with the movement, storage, and distribution of Title II U.S. food assistance. Please note that ITSH funds can only be programmed in conjunction with commodities sourced from the United States. ITSH funds cannot support costs associated with commodities procured locally, regionally, and/or internationally. For more detailed information concerning eligible uses of Section 202E and ITSH funding, please refer to BHA's Functional Policy 20-01. The link of this policy is available under the authorizing legislation section of the RFA. Moving along, the RFA asks applicants to focus only on Zambezia Province's Livelihood Zone 5. Factors that contributed in the selection of this region include the level of need. Zambezia is highly food insecure and approximately 62% of the population live in poverty. Additionally, Zambezia Province has some of the worst maternal and child health outcomes in the country. Zambezia has a very high level of stunting among children under 5 at 45%, and the highest infant mortality rate in the country at 64 per 1,000 live births. Within Zambezia, the activity's geographic scope will focus on the selected livelihood zone given its accessibility, the livelihood strategies employed by the poor and vulnerable populations, the size of the zone, as well as opportunities to layer, leverage, and sequence with other development investments. With that said, we'll move on to the next slide, and I'll hand it over to Mulaney.
Hi, everyone. My name is Mulaney Lewis-Martins, and I am the BHA team leader at Usaid Mozambique. What you're looking at is the CDCS of Usaid Mozambique, and as you can see, the overall goal is related to a resilient, peaceful, prosperous, and healthy Mozambique, and this goal is reflected in 3 development objectives: a healthier and better educated Mozambique, especially the young and the vulnerable, a diversified and inclusive economic growth, and resilience of vulnerable populations to key shocks increased. USAID's strategic choices align closely with the Government of Mozambique priorities, and this is articulated in the Government of Mozambique's recently released 5-year development plan, which spans until 2025. Both the Government of Mozambique and USAID recognize that 80% of the population subsist on small-scale farming, earning less than $2 a day. Nearly half of the adult population, including 2/3 of women, are illiterate, and only 37.5% of enrolled students finish primary school, which is the second lowest rate globally. Both USAID and the Government of Mozambique propose human capacity development and economic growth as top priorities. Importantly, USAID's focus on increased resilience to shock fit harmoniously with the government of Mozambique's priorities of strengthening environmental management and countering violent extremism. Next slide, please. As I noted earlier, the third development objective is resilience of vulnerable populations to key shocks increased. This RFSA clearly fits squarely under DO3 and fits snugly within the IRs under 3.1. USAID programming, in concert with the efforts of the government of Mozambique, the private sector, and other donors, builds the resilience of vulnerable populations to key shocks by increasing household food security and nutrition, improving sustainable management of water and sanitation, and preparing vulnerable communities to mitigate and withstand conflict, extremism, and natural disasters, which will better prepare Mozambique for the future and less likely to backslide on its journey to self-reliance. We believe that if USAID programming, working with the government of Mozambique and collaborators such as yourself, builds the resilience of vulnerable populations to key shocks by increasing household food security and nutrition, that Mozambique will be better off in the future. Next slide. As you can see, this slide is of Zambezia. In the box in the bottom right, in green, is Livelihood Zone 5. You will see that all but 5 districts have USAID presence, but not all districts are in Livelihood Zone 5. Some districts have more USAID interventions than others, and the biggest presence in Zambezia are activities related to health and HIV, mostly because Zambezia is a province that has some of the worst health indicators of the country. The health indicators are denoted by the medical symbol, and the HIV activities are denoted by the ribbon signals, just like you'll see the education, agriculture, and cash interventions each have their own symbol. So as an example, when you see the ribbon, these interventions are related to the HIV response. One of those activities is the DREAMS activities that strives to reach adolescent girls and young women with prevention and treatment options. DREAMS also aims to mitigate the impacts of HIV on young women by providing secondary school scholarships, assisting in entering the formal job market, and addressing the challenge of gender-based violence. Another example is the President's Malaria Initiative that has a strong program in Zambezia. PMI seeks to strengthen the community case management and works to strengthen the community and government data systems. As noted in the CDCS, the mission highly values the RFSA's ability to layer and sequence with existing mission activities. The efficient use of aid by layering and sequencing it effectively is a key step for beneficiaries, but also in sustainable development. And with that, I'll hand it over to Fadumo. Thank you.
Thank you, Malini. So the primary goal of the RFSA will be to improve nutrition outcomes for children under 2 in Zambezia's Livelihood Zone 5. The first objective is to sustainably improve women's nutrition even in the face of shocks. Here, applicants are asked to focus on improving women's nutrition as a key life cycle approach to disrupting the cycle of undernutrition. Within Zambezia and Livelihood Zone 5, barriers to improving women's nutrition are due to several factors, including but not limited to economic factors, cultural practices, norms, and food insecurity. Applicants will need to demonstrate a robust understanding of those barriers and propose a meaningful approach with a focus on interventions that contribute to sustained activity outcomes. The second objective is to improve infant and young child feeding. This objective focuses on the care and feeding practices that children receive within the 2 primary stages of development, from 0 to 6 months and from 6 to 24 months. Here, applicants are asked to design interventions in support of optimal breastfeeding and complementary feeding with an understanding of the nuance and issues related to the breastfeeding experience, as well as feeding behaviors and strategies. Under the section titled Additional Limiting Factors, the RFA provides space for applicants to suggest additional objectives that will complete a theory of change and strengthen the sustainability of program outcomes. Applicants are encouraged to identify, through situational analysis, the most limiting context-specific factors and propose additional objectives, one or more, that would support the goal of improved nutritional outcomes for children under 2 years of age and is within the manageable interest of the applicant. Activities proposed under this section should support and complement the other two objectives. I will now hand it over to Eric, who will provide additional details on the goal and objectives.
Hi, thanks, Fadumo. Hi, folks. My name is Eric Anderson. I'm a nutrition advisor with Usaid's Bureau for Humanitarian Assistance. Can you go back one slide quickly? Thank you. So I just want to point out that the draft RFA language lays out, quote, two initial primary areas for applicants to address, unquote. And I would just state that applicants can think of these as the basic immediate programmatic areas that USAID BHA expects partners to prioritize. These programmatic priorities are articulated in the RFA in a way that urges applicants to dig deep into the aspects of behaviors and, using a robust understanding of determinants of behavior, design interventions that will appreciate constructs of gender, age, and other factors that influence behavior. Next slide, please. This RFA for Mozambique asks applicants to approach the problem with an appreciation for the intergenerational nature of both chronic undernutrition and stunted linear growth in these communities. Real quickly, a mother unable to consume a diet that could adequately fill her accelerating needs during pregnancy may give birth to a baby with a low birth weight or manifest other deficits related to their nutritional status, putting them into a challenging game of catch-up growth as they begin their lives. Similarly, children who receive suboptimal care and feeding or otherwise are unable to achieve this catch-up growth often fail to grow and develop as they otherwise would, falling further behind the normal trajectory of growth and development. Children with stunted growth then can go on to become adolescents, and many of the conditions that prevented them from optimal growth and development as children persist, especially for those adolescent girls. Basic nutritional needs soar during this period of life, and the challenges to consume a diet in the quantity and quality to meet those needs prove to be nearly insurmountable. Finally, in the step to put the cycle on repeat, those same young women at some point frequently become pregnant themselves, and beginning a pregnancy with inadequate stores of important nutrients combined with other factors that limit their ability to improve their nutritional status, their needs again accelerate as the child inside her develops, only to be born, kicking off another generation. Next slide, please. The nutrition community, I think, just in general prides itself on being particularly guided by science and the best available evidence. In 2008, The Lancet published a special series on women's and children's malnutrition, and it's difficult to sort of overstate the influence that series had on the nutrition community. It provided a thorough review of available evidence at the time and helped to steer a large number of organizational strategic plans, programs, and policies. They revisited and updated the community with additional systematic reviews in a 2013 release, and just this month, they released a 2021 update in the form of a short series of papers. From one of those papers that I share this quote, which puts some additional weight behind BHA's emphasis on a strong focus on improving women's nutrition, not only as an end in itself, but also as a strategy to improve birth outcomes and promote early growth and development of future generations of children. And that quote obviously here is new evidence shows that stunting and wasting might already be present at birth, and that the incidence of both conditions peaks in the first 6 months of life. The 2008 special series really helped to galvanize programs and policies around the appreciation of the critical growth and development that takes place very early on in life. So early, in fact, that the, quote, 1,000 days window of opportunity was articulated at that time. And that period is from a woman's conception through the birth of a child and until the second birthday of that child. Despite the success of this notion in helping people to understand the importance of targeting children earlier in life and the challenges of achieving catch-up growth and development later in childhood, it's probably fair to say that much of the emphasis in programs and policies really focused on the second two-thirds of those 1,000 days. Building on the accumulated evidence in the community, this latest release helps urge all of us to renew our emphasis on intervention with adolescent girls and women, as there is even greater appreciation today of the need to reach girls and women prior to conception in order to meaningfully produce healthier pregnancies and better birth outcomes as a strategy to improve children's lives. Next slide, please. With that in mind, Objective 2 then is the complementary piece to build upon Objective 1 in pursuit of healthy, well-nourished children. Infant and young child feeding programming approaches should look to bolster care and feeding from birth forward, appreciating the rapidly changing needs of the young child. This RFA calls upon applicants to program to the, quote, mother-child dyad. And I want to stress this point briefly in our discussion of Objective 2. While the two objectives appear to be largely focused on distinct household members, this is not what is anticipated to be successful in addressing the challenges associated with this RFSA, or this RFSA. Rather, while Objective 1 is focused on improving women's nutrition and thereby necessarily working through activities that involve other household members and stakeholders, Objective 2 should be viewed as additive rather than transitional. Objective 2 still calls for emphasis on women's nutrition in support of IYCF. These objectives can't be looked at in isolation. We want to note that breastfeeding puts great demands, biological and otherwise, on a woman, and to assist women to be more successful in breastfeeding, both exclusive and early and continued breastfeeding later, they have to be supported. The RFA stresses the importance of the complexity of infant and young child feeding, aspects of timing, age appropriateness, frequency of meals, density of meals, diversity, nutritional content, feeding approach by caregivers, etc. All these dimensions should be understood and accounted for in approaches that seek to support behavior change in this area. An important note is this does not lay down an expectation that applicants will take on every behavior change effort involved in complementary feeding. Social and behavior change experts would be the first to warn against the dilution of messages like that. But rather, interventions are planned and managed with a robust understanding of the challenges faced by households in Zambezia in feeding and caring for young children. Just a couple few additional points of emphasis on this one is not unique to the IYCF or the infant and young child feeding area, but current assessments really must be conducted to understand the current realities. The global pandemic and the social disruption that has resulted from many of the mitigation measures. In some other contexts, we have seen to show significant impacts on care and feeding behaviors. It will be incumbent on applicants to avoid dependency on outdated data to inform their interventions. This RFA also explicitly calls upon applicants to program to improve feeding of children during times of infection or illness as a necessary and critical component to their strategy. And then finally, let me note also here that with the release of the Lancet Special Series earlier this month, that I referenced just a few moments ago, it stated, quote, new evidence supports the use of preventive lipid-based nutrient supplementation for reducing childhood stunting, wasting, and overweight, unquote. It may be relevant to applicants planning their approaches that Usaid BHA is in the process of establishing small quantity LNS products on our listed Title II commodities. Next slide, please. Additional limiting factors. So Usaid BHA understands well the complexity of working to improve nutrition outcomes. Stunted linear growth at the population level development challenge is particularly daunting, and it really begs for strategic approaches that appreciate health and nutritional status as functions of complex and interdependent systems. I included here the age-old causal framework for malnutrition, or commonly referred to as the UNICEF framework, looking at the underlying causes here and to some extent the basic causes below those, given understanding of these systems I just alluded to. Click, please. That said, the RFA asks for applicants to identify the most limiting, context-specific factors and to propose additional objectives that would support the goal. This approach in drafting the RFA is meant to avoid BHA telling partners what additional program areas to focus on and to invite applicants instead to design activities meant to overcome the obstacles to objectives 1 and 2. It's intended to invite thoughtful design and not to suppress or limit options. Any additional objectives and their activities are expected to be supported by strong justification for what is necessary based on the best available data and what is in the manageable interest of the applicant. The diagram included on this slide is borrowed from WFP's report on their Fill the Nutrient Gap exercise conducted in 2008 in Mozambique, and it's included to illustrate an example of how factors may be viewed to impede objectives 1 and 2. This Fill the Nutrient Gap tool provides a framework for improved situational analysis and multi-sectoral decision-making that identifies context-specific barriers to adequate nutrient intake among specific target groups. In their analysis of the costs for a nutritionally adequate diet, the figure demonstrates the percentage of the total cost of that diet broken out by household member. It provides a rubric through which to look at how purchasing power or the lack thereof may affect the ability to adequately feed the specific household members called out in this RFA. This figure is found in the draft RFA document and is used to illustrate the point of how applicants can think through how to design within this, quote, additional limiting factors, unquote, space. And with that, I'll conclude my remarks on technical aspects of goals and objectives.
Thank you, Eric, for that, and for also preemptively addressing one of the questions that asks, can BHA provide additional guidance on the additional limiting factors component, where applicants are invited to propose activities that complement the first two objectives. So thank you for that. I'll now hand it over to Adam to discuss the programming principles.
Thanks, Vidumo. This is Adam Reinhart. I'm the Acting Food Security and Livelihoods Division Chief in the Office of Technical and Program Quality in the Bureau of Humanitarian Assistance. And we are briefly going to go over the 7 programming principles that are in the RFA. The first one, which was just touched upon, is prioritization and focus. As we are all well aware, there are a highly complex set of determinants and factors that affect the outcomes in our program, and it's not possible for any one award to address all of them. Therefore, we expect the applicants to analyze and prioritize factors for each system and each objective. The most limiting factor should be targeted first, the second most limiting factor targeted second, etc. This will ensure that they are feasible and that the overall process's response is feasible and catalytic in nature and will be tailored to the needs of each of the subpopulations. And also, we will ensure that it can be implemented with a high degree of quality and impact in the time available and with the resource bucket available. The next one is design for people-centered approaches. BHA is committed to keeping the interests and voices of the most vulnerable populations at the center of our work and to craft development responses based on the strengths, priorities, risks, and needs of that particular target population. Thus, we think in this particular case, the applicant should work with and through communities to the maximum extent possible to create opportunities for the vulnerable populations suffering from extreme poverty and nutrition insecurity. People-centered approaches require addressing challenges, including shocks and stressors, that may undermine the opportunities for positive change and provide linkages to newly emerging or previously out-of-reach resources, services, and catalysts for change. The goal of sustainability, aka strive for sustainability. BHA is obviously committed to improving nutrition security for vulnerable populations in a manner that supports long-term and self-perpetuating change, as well as continued well-being of vulnerable populations. This is embodied commitment. This is embodied in our understanding, in our need to understand the operating environment and to strengthen local systems, both formal and informal, public and private, to increase the potential of sustained motivation, capacity, resources, and linkages in support of the continued impacts from our work. This is highlighted in the Tufts study that we did on exit strategies. There's also extensive guidance on this within the RFA itself in Section 4. The next one is leveraging collaboration to achieve collective impact. BHA anticipates that all of our applicants will strategically and operate work in line with the relevant national and local policies and systems and leverage and link with other stakeholders and actors working to address the drivers of food and nutrition insecurity to achieve more effective and lasting results through collective impact. This process requires coordination, joint planning, strategic alignment, and shared accountability among partners. The ultimate goal here, of course, is to ensure more holistic, impactful, and sustainable outcomes. The next one is social inclusion and local governance to strengthen local systems. Social inclusion and well-functioning local systems are critical to achieving both impact and sustainability. The applicant should identify, understand, and address social and gender norms in particular, with disparities and power dynamics and levels of diversity and inclusion, and the nature of participation within the local systems that exist. This should include social dynamics in local communities and formal and informal institutions in the target area. To enhance resilience outcomes, applicants should also consider the distinctive elements of social capital, bonding, bridging, and linking, which increase the potential for programming to be successful and sustainable in accordance with the current research on those topics. The next one is the use of evidence and learning for high quality and adaptive management. Applicants should leverage learning from past and ongoing programs to ensure the lessons learned and best practices underlie the overall approach to achieve the goals and objectives that are there. Effective programming learning approaches should also work to anticipate context-specific shocks and stresses before they occur. Overall, BHA encourages innovative, evidence-based, and adaptive approaches that continually engage community members to move populations suffering from or at risk of chronic malnutrition on a path towards sustainable change. The final point is safe, accountability, and inclusive programming. Applicants are expected to design and implement programs that protect safety and dignity, meaningful access, accountability, and participation and empowerment. Risk assessment should be conducted regularly, and applicants are expected to consult with representatives of different segments of the population, including but not limited to women, men, boys, and girls, people with disabilities, older people, ethnic and/or religious minorities, and others who may be marginalized or vulnerable, to understand the practices, capacities, and coping strategies, and to program for those groups accordingly. Applicants should also note the potential risks and address the 4 following elements within your overall approach. Prioritize safety and dignity and avoid causing harm, meaningful access, accountability, and participation and empowerment. There's more information on all these within the RFA, and we're happy to discuss any questions that you have. And with that, I hand it over to the next presenter, Killian. Thank you very much.
Thank you, Adam. My name is Killian Mtiro. I'm a regional monitoring and evaluation specialist with BHA. I'm going to go over the refine and implement model, as well as some of the key requirements for monitoring and evaluation. BHA will use the refine and implement mechanism. This is a post-award co-creation model that is meant to make a good design great. The model is designed to ensure activities are highly focused, tailored to the context, and adaptively managed to increase overall effectiveness. Some of the key activities that are conducted in the refinement year include a thorough review of the theory of change in collaboration with the BHA to understand and identify evidence and knowledge gaps in the theory of change, to conduct formative research and analysis that addresses the identified evidence and knowledge gaps. Small-scale operational research or pilots are also conducted in the refinement year. And I think it's important to highlight the meaningful and participatory community and stakeholder engagement that should be conducted in the refinement year to strengthen local partnerships in preparation for implementation. The different researches and studies will contribute towards refining the theory of change and implementation plans. At the end of the implementation of the refinement period, the award and BHA will agree on a revised theory of change and implementation plans. Appendix 3 in the RFA provides a list of major refinement year events and expected deliverables. Next slide, please. The theory of change and log frame required is articulated in the activity design section of the RFA. These two provide a conceptual framework for the activity design. For the theory of change, a diagrammatic representation as well as a narrative that articulates evidence to support the hypothesized changes, as well as other complementary activities and pathways to achieve sustainability are required. BHA encourages applicants to prioritize pathways that are most relevant to achieve the goal, and this ensures that the activity is well focused. For the log frame, this reflects the theory of change and must include the assumptions from the theory of change, data sources, as well as data collection methods. It's important to highlight the fact that for the log frame, only higher level outcome indicators should be included, and the focus should be on baseline indicators and not monitoring indicators, and the targets should also be included in the log frame. There is a link provided in the RFA to the list of BHA indicators that can be considered as you design the activity. Annex 6 of the RFA provides details on what to include in the log frame. As part of the application, an abridged M&E plan is required, and this must include an overall approach to annual monitoring, a description of the monitoring and evaluation staffing, as well as a strategy to strengthen the capacity of M&E staff, a summary M&E budget, and that budget should include the cost of M&E staffing, the cost for developing a database, and costs associated with the data quality assurance, monitoring, and participant registration. On the database, BHA encourages applicants to use cost-effective open source widely available platforms. And the database should be designed in such a way that it allows for unique identification of participants, as well as allow for linking participants to the households. BHA values the use of evidence to inform programming and adaptive management. And to that end, BHA intends to conduct an impact evaluation if the context allows. BHA will work collaboratively with the awardee to collaboratively design the most appropriate and relevant impact evaluation. As the impact evaluation design is likely to be a randomized control trial, an applicant must identify twice as many villages or sub-catchment areas as it plans to target to allow for randomization. Where the context potentially prohibits randomization, applicants must highlight such limitations in the application. Annex 9 of the RFA provides additional detail, as well as the BHA policy and guidance for monitoring, evaluation, and reporting for resilient food security activities. I will now hand over to Fadumo.
Thank you, Killian. On the key personnel, under this RFA, 6 key personnel are envisioned. This includes the chief of party, the nutritional technical lead, the social and behavior change lead, the gender youth and social inclusion lead, the M&E lead, and the strategic learning advisor. In the interest of time, I won't go through all of these positions. The specific roles and requirements of all 6 positions can be found in Section 4 of the RFA titled Application and Submission Information under subsection Management and Staffing. I will note that under the terms of substantial involvement, each key personnel position will require Usaid approval. Also, given the RFSA's nutrition-focused goals and objectives, the RFA includes a nutritional technical lead. The candidate for this role will draw upon their experience of technical and thought leadership on interdisciplinary programs focused on maternal and child health generally and nutrition outcomes. This individual will need to have demonstrable experience working across sectors to influence the nutrition sensitivity in programs and thus be able to lead their organization and program in the uptake of current evidence and serve as a resource to other sector leads who seek guidance on how to make their work more nutrition sensitive. Lastly, the RFA notes that at least 1 key personnel must speak Portuguese and 1 other dominant language found in the livelihood zone target. It further specifies that the nutrition technical lead candidate should speak English and Portuguese at a minimum, and there's a strong preference for a candidate who also speaks Ilumwe. Moving on to the evaluation criteria. The criteria listed in Section 5 of the RFA includes 2 categories: activity design, which is worth 70 possible points, and management and staffing, which is worth up to 30 possible points for a maximum possible points of 100. Under these 2 categories, there are subcategories which I'll go through now. Under the activity design, the technical approach subcategory is worth up to 30 points. Here, points are ascribed based on adherence to the specific goals and priority outcomes outlined in the RFA, the programming principles, and the criteria and themes listed in Section 4, the application and submissions, subsection application format, and activity design. The technical approach must include a context analysis, identification of key limiting factors, and analysis of why these were incorporated, a conceptual framework, a holistic and integrated approach, focus and prioritize technical interventions, as well as identified knowledge gaps for a refinement year learning agenda. I'll just pause quickly just to ask everyone to mute their lines. Thank you. Next, the goals-focused strategic targeting subsection is worth up to 10 possible points. Here, applicants will be evaluated on the potential of their targeting strategy to meaningfully engage households in a timely and strategic fashion. With regard to targeting, BHA notes that while it's important that the activity targets women and children under 2, as well as extremely poor and chronically vulnerable households that are at risk of chronic malnutrition, it is also important that the targeting strategies recognize and considers that these participants are part of a larger community. And so some activities may need to be more broadly targeted to foster social cohesion and strengthen community and household resilience. And on a final note on this section, BHA is looking for more than generic strategies targeting women which often fall short of achieving meaningful adolescent girl and young women participation. BHA is seeking specific and tailored outreach to adolescent girls and their meaningful inclusion in the overall program. Next, the sustainability and exit strategies section is worth up to 15 possible points. Applicants will be scored on how well conceived their sustainability plan is and whether it reflects their theory of change and describes, based on realistic assumptions, the resources, technical and managerial capacities, motivation, and linkages that will sustain the activity outcomes and or interventions after the activity ends. The score will also take into consideration the activity's design capacity to make sustainability a whole of project priority and not just part of the project closeout. The gender, youth, and social dynamics integration section is worth up to 15 possible points. Applicants will be evaluated on the extent to which gender and age dynamics as well as youth engagement are addressed in all areas of the proposed activity. Integration of a youth and gender responsive approach must be context appropriate and reflected at every phase of the activity. And plans for integrating gender analysis results and positive youth development approach into activities and tracking changes in gender and youth dynamics, including unanticipated outcomes. This would bring the total for activities design to a maximum of 70 points. Moving along to the management and staffing, the management and staffing subsection is worth up to 20 points. Scoring will be based on adherence to the criteria listed under Section 4 and will take into account whether the management and staffing structure ensures the efficient use of resources as well as effective and adaptive management, strong technical implementation, and administrative support. The scoring will also take into account whether the application includes all relevant information on consortium members and sub-awardees, and clear planning for refinement year activities and subsequent management and staffing adjustments that would need to be addressed. Applicants must also demonstrate a clear understanding of the country's specific requirements for the proposed uses of food assistance and an awareness of the restrictions that may hinder operations or implementation. Applicants must also justify how staffing and structure will allow for the effective and accountable implementation of any chosen resource transfer. And finally, the local capacity engagement portion is worth up to 10 possible points. Applicants will be evaluated on the extent to which local capacity engagement is context appropriate and built in all areas of the proposed activity, which includes the amount of resources managed by local entities, formal engagements through sub-awards, subcontracts, partnerships, or research, and capacity building efforts with local civil society and the private sector, such as NGOs, cooperatives, university, and so forth. In addition, BHA requires applicants to incorporate a plan under Annex 20 to develop the capacity of one or more local subrecipients to receive a direct assistance award from Usaid or other donors, and track the capacity development progress towards meeting the criteria for a USAID transition award. During the RFSA's refinement phase, the awardee will identify in consultation with BHA potential local subrecipients who have not previously received the award from USAID and whose capacity could be built during the implementation of the award such that they would qualify to receive a USAID transition award. The awardee will be responsible for developing the local subrecipient's capacity and tracking progress towards meeting the criteria for a transition award. At the conclusion of the capacity development phase, if applicable, the awardee will notify USAID of the local subrecipients that meet the initial award capacity development criteria for a potential transition award. There would be no guarantee that BHA will make a transition award, and decisions related to issuing a transition award and the selection of a recipient are solely within USAID's discretion. For more information on the process for transition awards, please refer to the ADS mandatory reference 303_MBB, which can be found linked in the RFA. This brings us to the conclusion of the presentation portion of the briefing. We will now move to the questions and answers portion of the program. Okay, so the first question we have here is, could you explain the difference and purpose of between Title II and CSD? I assume it's meant CDF. I can quickly state that the Title II of the Food for Peace Act primarily involves USAID food commodities that are grown within the United States by farmers and sent overseas to feed vulnerable populations, whereas development assistance from CDF are intended to complement Title II RFSA programming in several featured target countries and resilience priority countries. So through CDF, USAID is able to program resources through its partners to fund community-level RFSA interventions. However, the difference between the two is mainly the statutory source. CDF, the statutory source for these funds, come from Section 103 of the Foreign Assistance Act of 1961 and not the Food for Peace Act. Etienne, do you want to add anything to that?
No, I think you covered it well. Was also adding a link on, I don't know if it made it, yeah, on the USAID website where you can also have an overview of these funds. So as Fadumo stated, so Title II is funded by the Title II Act, and it's mostly known because of use of U.S. commodities rather than other countries' commodities. So that's what it's known for, and CDF is intended to, at a broader level, to complement and support the Title II appropriation. Over.
Thanks, Etienne. The next question states on page 10, the RFA states that BHA does not intend to prescribe the amount of in-kind Title II commodities applicants must propose or the time frame during which they must be programmed. However, this presentation states that applicants may request up to 50% Title II Section 202E. Can you confirm that 50% of total research should be in-kind commodities and ITSH and a limit of 37.5 million in Title IIe? I'll state that the RFA does reference that applicants may request up to 50% of Section 202E. So it can be found stated in the RFA. That doesn't mean the applicants must request up to 50%, hence why the additional language provided that BHA would not prescribe the amount of in-kind Title II commodities applicants must propose. So applicants have that option based on the program that they designed to request up to that amount. Etienne, do you want to add anything there?
I would just say that you are welcome to comment about it, include it in the in your email to the email address, and it will be addressed. But the response FEDUM has already provided it. If there are further consideration, it would be addressed further. Over.
Thanks, Etienne. The next question states, draft RFA reads in part, page 10 of 90, subject to the availability of funds and commodities, applicants must request in-kind Title II resources. The highlighted caption from the draft RFA conflicts with the current Mozambique national policy direction, which is to promote local agriculture, markets, and products. In addition, the government of Mozambique does not authorize in-kind food imports for non-emergency purposes. The question is the government of Mozambique aware and okay with the proposed importation of in-kind commodities for non-emergency purposes? Melanie, do you want to take this question?
Sure, thanks, Fadumo. We understand the reticence of the government of Mozambique to receive in-kind assistance in non-emergency situations. However, once the specific in-kind commodities are confirmed, Usaid will work with the implementing partner and the government of Mozambique to obtain approval for their importation and usage. Thanks.
Thank you, Melanie. The next question we have asked, can BHA provide more information on the expected target population coverage under this RFSA? The Mozambique draft RFA does not provide guidance on which districts within Livelihood Zone 5 should be targeted. Is there a preference for specific districts that BHA expects to target? So I detailed in the presentation what's expected from in terms of the target population. I will add on the second part of the question that the applicants, BHA, the only limitation is that applicants focus on Zambezia Province Livelihood Zone 5. Applicants are free to propose whichever district they think would be best for their activity. There's no preference for specific districts listed in the RFA. Does anyone have anything to add on that question? I don't hear anyone, so I'll move on to the next question. So it states Appendix 3, the relevant map on page 90 has Namaro, which is within Livelihood Zone 5 color white. Why has it been colored white? Does this exclude Namaro as a district of target, a district of interest or a target district? Melanie, I'll direct this question to you.
Thanks, Fadumo. Namaro is part of Livelihood Zone 5. I believe it is colored white because there are no known Usaid Mozambique activities taking place in that location. Thanks.
Thank you, Melanie. The next question states, as described in Mozambique, important causal factors of malnutrition are lack of access to food, chronic poverty, and vulnerability to shocks. The relative lack of attention to agriculture, livelihood, NRM, and resilience issues in the draft RFA may limit our ability to address these causes of malnutrition. The first question states, can Usaid provide further information on its expectations to include livelihoods, agriculture, natural resource management, and vulnerability to shock-related interventions in applicants' proposed programs? So on that first question, I would state that I think the RFA provides that category of additional limiting factors for applicants to consider other vulnerabilities that the target populations face, and gives them the flexibility, applicants the flexibility to propose other interventions. They could be agriculture interventions, livelihood interventions, but as long as they contribute to achieving the objectives and the goals stated in the RFA, BHA would consider those interventions. Is there anyone that wants to add any other response to that question? Okay, so the second part of that question asks, does USAID have any upcoming agriculture and/or livelihood programs planned that includes the BHA Livelihood Zone 5 during the RFSA's period of performance? So that question, I think we can state that USAID will announce any upcoming programs if, when, or where appropriate, and that announcement will of course be made available publicly. Does anyone else have anything to say on that question? Okay. So the next question states, regarding breastfeeding in IYCF under SO1, can BHA please clarify expectations around the statement, quote, be cognizant of mental health and its relationship to the breastfeeding experience, unquote. This is on page 18. The phrase of be cognizant of does not clarify if BHA expects applicants to include mental health concerns and interventions in the design of applications. Please clarify BHA's expectations around this issue. I'll hand it over to Eric to address this question.
Yeah, thanks, Fadumo. Good question. The quoted language is indeed what is found in the RFA, and I'd just say that as with other mentions around details and dynamics of breastfeeding or complementary feeding, its inclusion, it being mental health, its inclusion should help applicants to understand the breadth and depth of analysis that is anticipated to inform the development of the activities. And then thereby it's going to be incumbent on applicants to determine just how these and other factors can be addressed in the activities that are best posed to meaningfully improve outcomes and mitigate, and importantly, mitigate any unintended consequences. You're probably not going to love that answer, but I would just steer you back to the RFA and note that we've called it out, as with other dimensions and other details, as a way of illustrating the importance of thoroughly understanding all of the issues that go into supporting households in this particular programmatic area. Over.
Thank you, Eric, for that. The next question we have here asks, are all the programming principles considered of equal weight, or are some more specifically applicable to the RFA than others? Adam, do you want to provide your feedback?
Sure, that's a great question. We anticipate that all the programming principles will be relevant to the RFA in more or less an equal fashion. Like, these are programming principles for a reason, and they should incorporate into the overall technical approach of any and all applications that are submitted. Over.
Thanks for that, Adam. The next question we have here is, the RFA states that public international organizations, or PIOs, are subject to different requirements. Where can these requirements be found? I'm not sure if I can pass this over to Etienne, but I'm sure that if it's not in the RFA, then we would add a link in the final RFA to allow applicants to see these requirements. Etienne, do you have anything to add?
Sure. Yeah, so per the RFA, if we reserve the right because PIOs are subject to ADS 308, and I just included the link in there. So reserve the right to award them on using the requirements for PIOs in ADS 308. I had also shared earlier the link about the funding, the color of funding. So I'm adding also another link, which these are all in the RFA itself, so you can find them there. But the BHA functional policies, so one example is the BHA functional policy 20-01, which addresses eligible uses of Title II associated costs, monetization proceeds, and community development funds. So you can refer back to these documents as you are trying to understand Title II as well. Over.
Thank you, Etienne. I don't see any further comments or questions. Is that correct, Hillary?
That's correct.
Okay. I'll close this out by just reminding everyone, if you do think of any other comments, questions, or suggestions that you have for BHA with regards to this RFA, please do send them to the email that we listed earlier in this presentation and that is listed within the RFA by the end date that's been prescribed, so by noon on April 5th. We thank you again for joining us and for your interest in this solicitation, and we look forward to hearing from you. Thank you all.